I'm Kathy Eckert, the Director of Crisis Intervention Services for Mental Health America of Greenville County. I'd like you to meet some of the people that have dedicated their time, their talents, and their patience to taking calls on our crisis line.
I wanted to do something with my time that had some meaning and might have a positive impact on the world, because I wasn't getting that anywhere. It can help people by listening to them. And it's just incredible how powerful it is.
And I knew I wanted to do something in the field near psychology, and I found MHA, and it honestly has been like one of the best decisions I have made in my life, just because I've been able to make so much of an impact for people.
They have somebody who cares. And that is the world to me, is to be there for those people nobody else is there for. We speak to the whole spectrum of humanity, from the richest of the rich to the poorest of the poor and everybody in between.
I think there's really a belief that the kind of people who call us are going to be teenagers. They're people who are younger and who haven't lived their lives, but I've talked to someone who was in their 80s. I've talked to someone as young as 10, and I've talked to someone who was in their 40s, a dad with kids in the background.
When they're on the phone and I've got them in my hands, they're the most important person in the world. I'm not letting them go until they're safe. And they can be in their mansion or they can be on the street, and I'm going to keep them there until I know they're safe. The calls that impact me the most of the time, is the sound of the call, hearing the person's pain, hearing the screaming and the wailing. It comes through the phone. Even though phones reproduce this much of your voice, it comes through. I talked to somebody for over an hour, and I wasn't looking at my watch going, oh, it's been up to 20 minutes, I'm going to wrap this up. No, let the woman talk about her problems, everything going bad in her life, which is a lot. And after about an hour passed, then she said, oh, I have a bottle of pills in my pocket. So then we changed to, let's get those pills out of your pocket, let's get them away from you. And we ended up with her deciding to do something other than kill herself that day and keep herself safe. And again, the power of listening is just amazing.
You know, I can remember one exactly where it was. It was someone who told me that they were going to kill themselves as soon as they got home. They told me they were 30 minutes away and it was going to happen. And I sat with them for more than 30 minutes. I sat with them for an hour. And by the end of that hour, they no longer had that plan to kill themselves. They no longer were going to do it in the next few minutes. It was now this, I have a plan for tonight. I have a plan for how I'm going to stay alive. And it wasn't a long-term solution, but it was a solution for now. You know, I think that's just such a reminder that we're not focusing on fixing someone thinking about killing themselves. We're focusing on helping them and keeping them safe for now.
It's not easy work. Sometimes you have to take a break. You have to walk out of the room for 15 minutes, or whatever. Sometimes I've had to scream into a pillow. But it's always rewarding. We know we've planted a seed, that they were treated with dignity for a while, even though they don't see any hope at all. Somebody out there doesn't even know their name, cares if they live or die.
It's not that we're trying to fix someone and their thought process. It's we're trying to provide support. And it's really hard to walk away from a call that didn't go the way you wanted, or, you couldn't help that person, or they hung up on you. But then there's also those calls where you do speak to someone for hours on end. You see them call back regularly and they tell you, this stopped me. I was going to kill myself, and now I have a plan for tonight.
I'm especially there for the invisible people. The people nobody makes eye contact with. People that everybody says, shut up. They need an ear. And I could talk to them for 10 minutes, 15, 20, like they matter, when everybody else thinks they don't. And that can keep them alive. We have an intense training program. You can't pull somebody off the street and have them talk to somebody suicidal. It wouldn't be safe for that person, and it wouldn't be safe for the caller. So we go through an intense training, and it involves us listening to calls, live calls. It involves other people listening to us as we take our first calls. And we're not on the phones until we're ready and deemed ready.
I can honestly say, looking back, we do have 50 hours of training. You do a lot of work on the phones before you're actually by yourself. But listening, it's a skill that, you think you have automatically. You go, oh yeah, I'm a great listener. People talk to me all the time. But you're not always listening. And I learned how to sit back and to just sit in silence, because sometimes silence is listening, to not talk. And that has just changed how I view my interactions with people around me, because I can be there for someone not by providing an answer, but by listening.
And once the call is over, a lot of times we don't know how the caller is after that. And we're still, riding that wave of emotion, because we've worked hard to build a bond with somebody. And sometimes it'll make you tear up, because it's real. Before we let it be over, we work with the caller to make a safety plan. What are you going to do to keep yourself safe? What are the steps you're going to take, including calling us? And then if that call ends and we're not really convinced that they're going to be totally okay, we will arrange with them to call them back a couple hours, tomorrow morning, whatever, and just check in and say, hey, how you doing? Are you better? Are you worse? And again, do not want to let these folks go until we know they're safe. Other than money, I'd say be a voice. Suicide is so scary for people to talk about. Just be an advocate, really, and tell everybody you can about the Lifeline and what it does, because this work is important. It's intangible. You can't show up. You can't make a TV series out of it. It's a lot of thought process, but it's so important and saves lives.
Well, you can start by reaching out to volunteer at MHAGC.org. You can go to our website. You can also apply there. After that, we have a very extensive training. It's true, it's lengthy, but we want everybody to be very prepared for it. You don't have to have psychology background. You don't have to have a specific degree in that. You just have to be willing to learn something new, and anyone can do it.